Doctors of Reddit, what patient made you go, how are you even alive? We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented, and we were shocked he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s, he was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile, he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off to surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the ER, because I think it just reminded me that hope and good outcomes are still out there. I've had a very similar case. Fit guy in his 50s came in looking like he was having a steamy but normal ECG. I could see a dissection flap and got him to the scanner in about 2 minutes. Cardiothoracics came down. Told him he had 80% chance of dying intra-op. He was calling all his family and some friends to say goodbye. It was fucking heartbreaking, and made controlling his BP impossible. Every time he started talking to a new person on the phone it would shoot up. Anyway, he made it through surgery. Extubated the next day. I went down to ICU to see him and he was sitting up eating lunch. Lady in her mid-30s was in the clinic for a 1-week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg/dl, normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her kids, teens, had been sneaking giant 64-ounce sodas and candy bars into the hospital, literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how did you survive that, but how do you even function on your own? My wife's father died due to diabetes complications. He'd been in and out of the hospital for several years. He went in on a Friday, they amputated toes on Sunday, he was dead on Monday. Nobody was prepared, but nobody was surprised, either. When we went to his apartment to clean it out, and there was candy everywhere. Under couch cushions, pillows, in his bed, in all of the cupboards. I have a sweet tooth and I can't imagine wanting this much candy. The man killed himself. I know a guy who keeps telling me that he never takes insulin and drinks 40 ounces of Mountain Dew a day and his diabetes hasn't caused him any problems yet. Same guy also had his foot amputated a few inches above the ankle a year ago. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. A friend of mine had to get his entire leg amputated because he slipped off the bottom step of a ladder, and bent his knee backwards. It apparently pinched some type of main blood vessel as his entire leg eventually got necrosis when they had him in the hospital. They tried to helicopter him to some other hospital but there were high winds, so they had him sitting there with the necrosis spreading. Over a stupid 1-foot slip. Edit, to basically answer everyone's question. It just happened 3 weeks ago. I visit him and we both kinda look where his leg used to be and just think, what the fuck? He is taking it pretty well but we kinda nervous laugh at how bizarre it was. I was right next to him and his knee didn't even bend back that far. No broken bone or anything. But he was in pain so I forced him to the hospital when all he wanted to do was ice it. It's crazy how strong but delicate the body is at the same time. Has a physical therapist and was always in top health. He was the exact weight he should have been. While he was in surgery, the doctors told his family that he had the possibility of not making it. When they called me, I couldn't comprehend how on earth it could be possible. Then they said he would live, but the entire leg had to go. But like I said, he is taking it fairly well. I was on a home call for ER in a small town. Got a call from the ER nurse one night and she was like, EMS brought someone in here and they think she might be dead. I was like, well, is she? She was like, I don't know. This was a seasoned nurse, by the way, so without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and then suddenly moved. Potassium of 1, for those familiar with lab values. The backstory was extreme self-neglect/depression combined with caregiver neglect. Weighed in at 67 pounds at a height of about 5 feet 5 inches. We actually resuscitated her, very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. For those like me who are curious, potassium levels of 3.6 to 5.2 is normal. Anything less than 2.5 is life-threatening. Seems like a relatively wide range for normal, but it doesn't take much to get into deadly territory. That's kind of scary. I'm going to go eat a banana. I had to have 4 bags of potassium pumped into my veins once in resus. Was the most painful thing I can remember. They tied my hands down to stop me pulling the 4th tubes out. They also kept trying to get me to drink it. It's gross. An eyeball can wrinkle? Yes, from dehydration. Until that episode, I had only ever seen it in dead people who has been dead for a good few days. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head. Essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand to the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later I'm now on my ICU rotation and I see this guy awake and conscious. It's pretty crazy. Any update on his condition? It's crazy. When I saw him, we were basically seeing how much function he would get back, but he was going to be in the ICU for a long time. From what I can remember, he couldn't really move either leg, but he actually had some movement in his arms/hands, so they weren't sure how much he was going to get back by the time he left the hospital. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open heart cath surgery, coronary artery bypass surgery. He needed 12 units of blood, his heart massaged then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks. He was unresponsive every day. On week 20 he had to consult ENT to take maggots out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24 I believe. At 6 a.m., he opens his eyes. I was shocked. He has a permanent trautendostomy now, but somehow is alive. My dad is 87, he had prostate, liver, bowel, colon and skin cancer. For the skin cancer he had lots of reconstructive surgeries. His whole tibia region and the back of his hands, every year he has to have at least 1 skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. If I were a doctor or scientist, I'd want to see this guy weekly so I could study him and give other people his immortality. A guy I took care of during my residency, fucking cyborg. I was the chief on trauma. Got a page about a patient en route with a stab wound to the chest. When the patient rolled into the trauma bay, he had no pulse. He had been stabbed in his left upper chest, 3 centimeters below clavicle. He got an ER thoracotomy. If you want to feel like a badass, then do an ER thoracotomy. We were able to cross-clamp his aorta. We took him right to the OR. We oversewed one small artery below his rib, then transported him to the ICU still intubated. 8 hours later he was extubated and wanting breakfast. Seriously, dude? He was dead 10 hours before. He was also a complete asshole. No wonder someone stabbed him. Patient here. When I was 2 I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan. This was 1990, and when they were done, they turned me back over and I was blue, had stopped breathing. CT revealed a volleyball-sized mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside my ribcage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. I made a full recovery. I am a healthy 31-year-old now. 0 asthma. Only remnant of the night is a scar that goes from the center of my chest to the center of my back. WTF. Yep, it's called fetus in fetu. Have you ever had similar cases? Leave a comment. And subscribe to this channel if you wanna see more same videos.